Okay, so we're here with Dr. Gurney and Debbie, who's our photofacial demonstrator. So you can see what he's doing here.
And photofacial is a therapy that uses intense pulse light, not a true laser, but a pulse of regular spectrum light, but very bright, very intense. And what it does is that light is picked up by the pigment cells in the skin, the reds and the browns, and it's intense enough that causes that pigment to coagulate, and gradually it comes to the surface. So it's just a brief little shot in each area. Here we go, 1, 2, 3. And that treats all the pigments in that area. In a couple days, all the pigment gradually comes to the surface.
Does that hurt, Debbie?
Nope, not at all.
What's it feel like?
A little cold and just a teeny little bit of hotness.
Okay.
There's a coolant in the tip that cools the skin right before the pulse so that the skin doesn't overheat.
And as you can see the pulses, but when we get closer you can see how red, we saw the pre-pictures, you can see how red her skin gets. It feels just a little bit like sunburn, and you see the pigment, the areas of freckles are actually darker, and those should just then go ahead and peel off over the next week or so. Post-care is no makeup for 24 hours, no heavy exercise for 24 hours, and just no picking. We give you some post-care instructions along with some product to use.
And that's it, Debbie. One other thing I wanted to mention is that it causes the pores in the skin to shrink. It's a temporary shrinkage. It lasts for weeks to months. But it does a great job of that as well as pigment.
Great. Thanks, Dr. Gurney.
Okay.